following is a local resident producers program. The program content is the sole responsibility of the producer and does not necessarily reflect the views or policies of CATV2, Oshkosh Community Media Services, the City of Oshkosh, or Time Warner Cable.
Hi everybody, welcome to Eye on Oshkosh. Cheryl Hentz here, and this evening we're going to be talking about healthcare reform, as is most of the country these days, I think. Joining us to talk about that is Tina Haffeman. Now, Tina has, as a member of Trinity Episcopal Church, has recently helped to organize a healthcare reform forum, I guess, is what we can call it, and you had a number of people there. So anyway, welcome to Tina, and we're going to be talking about the recent forum. It was held just a few weeks ago as we're taping this, and we'll find out who some of the players were in the forum and what folks had to say. So anyway, welcome. We appreciate you being here.
Thank you. I'm so glad you asked me.
So you held this forum, and I thought I had the date here, but
it was July 30th,
okay.
Thursday, July 30th.
So just last week, as we're
Right.
taping this on the
Right.
6th of August. And I guess, first of all, why did Trinity Episcopal decide to sponsor this forum? And later we're going to be talking about some of the other forums that you guys are going to be sponsoring. Right. But this is part of a community outreach type thing?
It is. I'm on the vestry at Trinity, and we were asked to host, I don't know if you've ever heard of the group Esther.
Yes.
Esther is a interfaith advocacy group, and I am a member of that individually. It's up like Neenah and Appleton, and we don't have one here, but I like what they do, and I go to their meetings, and I like the way they hold them, and indeed they held a forum like this in March, and I thought, I think that would be helpful. In the meantime, in the spring, our church was asked to host something for them, and when we did, some members of our congregation who are in healthcare came to that and said, maybe we should hold some formal discussions about healthcare. Yeah. I said, that's great, because you want somebody else to come up with that. And so Wayne Winnestorfer, who is the Director of Rehabilitation Services at Affinity, and the Killingers, who are both retired in healthcare, and I just got together and decided that what might be important to do was to bring local information to people firsthand, because there's such a glut of information with so much opinion attached that maybe if people could see it firsthand, it would be best. So we had so many ideas about it that we decided right away to do a series of forums. And so that's what we're working on.
Okay, well, and of course the first one, as we said, was on healthcare. And so about how many people from the community attended this forum?
There were 37. It was, my partner Wayne Winnestorfer is very, very precise. So everything, like it was 6:30 and then 6:32. And there was 37 people plus the people. So we know everything specifically about it. So there were 37 people, not counting
people there,
the
and then the presenters.
Right.
And who were the presenters? Because they covered kind of a wide spectrum throughout our community.
They did, and I was so pleased because they were so kind. I just sort of started calling people in different healthcare venues to see if they would help, and they all said, sure, yes. And I said, really, you're going to give up an evening in the summer? And they said, like I did, well, this is the summer of healthcare, so this would be the summer we would do it. Yeah. So we're just going to go ahead and not worry that other people have picnics and just go ahead and try it. Well, so we went ahead and tried it. So we had Alex Hummel, who is now with the Christine Ann Center, because he, of course, has all kinds of health issues that come to him there. And Pam Van Roy, who works at the Living Healthy Clinic, which is a free clinic that I did not know about.
Is that the one out on Bowen Street?
Yes.
Okay.
Yes, it is. And she is a nurse there and came to talk about that. And then Mary Jo Turner, who came from Winnebago County Health. Okay. And Jim Killinger, who is a retired dentist but was one of the founders of Tri-County Dental.
Okay.
And then Susan Garcia Franz, who works with the Wisconsin Well Woman program up in Appleton, but it also serves Winnebago County.
Okay, all right. All right, and so what was the main message that you were trying to get across to people, or what kind of feedback were you looking to get from people? I think, as I understand it, it was gaps in the healthcare system or the delivery of healthcare, and some of the challenges that people are facing as they try to get just the very most basic of healthcare.
Right. We, me included, because we don't see these things every day ourselves, I think it's important to get as much information as you can from the person doing it. And these people are all on the front lines. Every day they see people who are in various stages of desperation and who have varying qualifications for programs or not. And so they see it all day, every day. So what we hear about sometimes, like, oh, there's 45 million uninsured and 25 million underinsured, we just go, oh, yeah, that's too bad, because I have my insurance. So but hearing about it firsthand is important to consider when all these changes are considering, and when there's so much going on about it that you need to form opinions over. I mean, I think people appreciate knowing what happens firsthand, and that was our motivation.
Well, and I think too, Tina, it's like years ago, just about everybody had insurance, who was working a job. But now we've got a lot of people who are out of work. And yes, when you leave a job, you can pick up COBRA, your insurance for a while under COBRA, but that's almost cost prohibitive.
Oh, it's
I mean,
very
because
bad.
you've lost your job, and then you're supposed to pick up the entire premium, not just what you were paying before. It's usually twice or three times as much as what you were paying before. That's cost prohibitive in most cases. And there are ways where people are falling through the cracks in the system, although I think those cracks are closing up a little bit now with Badger Care Plus.
Helps.
But nonetheless, now I think people would be shocked if they knew that, their cousin or their niece or nephew or their next door neighbor maybe didn't have either any insurance or had very inadequate insurance. It's kind of like people are becoming the new poor instead of the new rich.
Exactly.
And people are being bankrupted, literally, by medical bills.
You're absolutely right. It used to be that I never knew anyone. Of course, I'm a retired teacher, and so my friends were teachers, and teachers are insured, and so I never knew anybody. I never knew anybody that wasn't insured. And in the last 5 years, I know many, many people who are insured, who are uninsured or underinsured. And when I say underinsured, I'm talking about health care plans that insurance plans that have large gaps or are real high deductible, which I think are really not insurance, are just gambles that you're not going to get sick. And I'm of that age where, and these friends of mine who are uninsured or underinsured are of an age when things start to happen, and they haven't before. You've been, healthy, everything's been fine, and then suddenly it's a big one, and it's past your, it's $9,000 then, because that's what your copay was. And I don't know, a lot of people just don't have $9,000. It sounds, when you sign up, is this only $1,000 for this policy? And then I just have to not get sick. And that might work out for small things, for physicals, but then if you get something big like a kidney stone or lots of things, then there you are. And then you have to do it again the next year while you're paying that one off. I mean, it's really, really rough.
Well, and with the cost of medical care or dental care, it can add up so quickly. I mean, even just the simplest of things, they want to test for this or test for that. Well, those tests add up very quickly. And before you know it, something like a kidney stone, small as it may be on the grand scale of what someone could get physically and have wrong with them, that could easily be a $15,000 thing if you have to have surgery.
It is always a few $1,000s.
At least, at least. So, and we're sorry that some of these folks who participated in the forum couldn't be here tonight, but we do understand it's summer and, people have other things going on as well as other professional obligations that couldn't, allow them to be here. But maybe we could go down the list and talk about what each of these folks expressed as far as what they're seeing as far as some of the gaps and the obstacles in people being able to get access to health care.
Sure.
Do you want to start with Susan?
Sure. Susan works for the Wisconsin Well Woman Program, and what they do is they give mammograms. It's women's health care. They give mammograms and Pap tests for people who meet this criteria. And one of the things that she pointed out, the criteria is a little complicated. And so one of the things she pointed out as a gap is the navigation of these things. This is, while very helpful, rather narrow. This is women with women's issues that are between ages 45 to 64. Your health insurance does not cover basic checkups, and you follow these guidelines. And the guidelines for many of these programs are different, so the navigation of them is a little bit difficult. One thing I remember she pointed out was that, so they provide the screening free if you meet these qualifications. Then a large percentage, and this is the kind of thing I don't remember that would be nice to have her here for, but a large percentage of women of this age in particular have fibroid tumors, uterine tumors. And very often are like nothing, but they need to be checked. And the way to do that is a uterine ultrasound, which is $800. And that is not covered. Okay. So then this large percentage of women then has to wait until it's become, and if you wait until this kind of thing affects you and makes you sick or you see, then it's of course much more or maybe impossible to treat. So that's the kind of gap.
So they do the screening and that's it?
They do the screening,
okay.
Right.
All right.
Right. And then give advice and also help them navigate through. Now you mentioned Badger Care, and Badger Care is very, very good. Wisconsin does a really good job, especially with children. I think they're number 3 in taking care of their children. It's great, but they're, even in Badger Care itself, there's quite a bit of navigation. There's now a new program, which is a very good program called Badger Care Core, or Badger Care. There's Badger Care Plus, there's Badger Care Plus Core. I'm not sure of all those, but there's many of them. But the new one that came out just July 15th is
I think that's Plus.
That's Plus.
Yeah.
Is for women, people, well, I'm not sure if it's for women, who don't have children. I mean, children have been cared for. We started there, which is a good place to start. And now this is for women who don't have children. But that has its own set of criteria. The paperwork is pretty big, and it might also overlap with something else you're doing in your family, with that paperwork. Plus, there's a cap, and I think the cap is 40 or 50,000, and they're worried about that now because it's like they think they're going to reach that pretty quickly. So that's a problem, the cap on that.
And I just want to interject. I believe that men are covered by that also.
I wish I knew
because
that.
I
think you're right.
mean, I'm not
Why wouldn't they
100%
be?
certain, but I'm pretty sure because I know of someone whose brother just recently applied, and so I think that's
adults.
Okay.
Adults with no dependent children.
Okay,
yes.
and that's the Badger Care Plus,
right?
Which you can find information on that online.
You
just
can.
Google Badger Care Plus, and it comes up. Okay, so were there other concerns that Susan had expressed about some of the gaps or challenges or obstacles that she sees, or was that pretty much the gist of what she put forth?
Talked a lot about. She also pointed out that 80-20 insurance is also not a very good insurance because a cancer diagnosis and you have 80-20 and then you're wiped out. So she, was making a case for more inclusive coverage.
And 80-20, of course, being where you meet your deductible, then the insurance company pays 80% of the bills, and you pay the remaining 20%. And then I think at that point, once you've met your 20%, they pick up the balance, I think. I'm not sure.
It depends, you see.
Well, there's a stopgap
right.
in a lot of cases. Say you've got a bill of $10,000. They'll pay 80. You pay your deductible, they pay 80%, you pay 20%, then when it reaches that level, then they come in and pick up the balance. I think that's how it works. At least that's how it always used to work.
Yes, that's how some of them work. However, see these things.
They're all different.
They're all different,
changed.
which is one of the problems.
Yeah.
And seeing as you said used to be, that is another problem she actually mentioned was that the changes in the way employer-based insurance is, they're taking more and more and more and more away. So they are changing almost monthly.
Yeah.
So I think 80-20 used to be, it'll probably soon be like 60-40. I mean, I haven't heard of one like that, but I mean, that's the kind of thing that's happening, that they're reduced because of the costs. So they're
Well, and the other problem here, Tina, too, is, these insurance companies, they seem to be so greedy and so profit-driven. I mean, nobody is denying that someone who's in a business should not make a profit.
Indeed.
But do we have to be so profit-driven and so greedy that, I mean, you're there to cover people's health insurance needs. They're paying premiums for a very long time, and pretty hefty premiums in most cases. And what's ending up happening nowadays is you have one or two claims, and all of a sudden they don't want you anymore.
Right.
They drop you. And once you've been dropped by a company, it's very difficult to have another company pick you up, because they have access to seeing what your past claims have been.
right.
And so it's this vicious cycle that you can't really get out of, and that's why there's so many millions of people in this country that can't get adequate insurance.
Absolutely. That vicious cycle is tough in paying for it too, because you end up, maybe you have that $8,000 high deductible thing, and then you have to take out a loan.
Yep.
For that, and then they get behind that, then it's on your credit report, then you can't go to another provider. Yeah, there are quite a few vicious cycles going on there that are making it very, very hard.
Who's the next one on the list?
The next one on the list is Alex Hummel at the Christine Ann Center, who has their own sort of a more unique set of problems. And I think that one of the things I think people don't think about very often is that women who come there, for a safe haven, very often can't. Their coverage goes along with their relationship very often.
Yes.
And so when friends or family will go, "Why don't you just leave?" It is not really a very helpful thing. I mean, it's not always insurance, but I mean, that is one of the things. Economically, it's a pretty tough move.
Sure.
And leaving insurance, I think there are many people married still because of insurance connections.
Sure.
I have to say, I remember when my daughter long ago was dating, and I would say, "Oh, he seems nice. Does he have insurance?" It was a big factor.
That was the prerequisite,
yes,
right?
Yes, I believe she was just getting ready to go on a Cobra, and we were like, "Uh-oh."
Yeah.
So that's another section of underinsured people are the kids leaving home or leaving school that have always been under their parents, and their parents have always thought, "Oh yes, this is all fine," and they're all under ours, and then suddenly, yikes, they don't have a job that has any, or they don't have a job yet,
Yeah.
and then this Cobra kicks in, and parents, and they have to pay. It's rough, really, or they go without, gambling that they're going to be okay, and then, of course, the gamble's tough because you start out young and something happens, and then you're further behind the 8 ball than you were. That's a big section of people.
Right. Okay, so Alex, who's the next one?
The next one is Pam Van Roy from the Living Healthy Clinic, and I have to say I didn't know the Living Healthy Clinic was there, but she talked a lot about. It's a wonderful place. It's served by nurses, nurse practitioners, and then 2 volunteer retired doctors in town who come in each half a day, which is a really wonderful thing. But she said, of course, often when they see people there, they are already at some critical stage.
Sure.
Because they don't come in for a routine thing, even though sometimes that would be covered. And so they then have to say, well, you need to go to the ER or you need to see a doctor, and then that's not possible for them.
Right.
So I think was her biggest worry about that. And then she also talked about the gaps in drug coverage. Diabetics is a big problem because it's expensive. So there are, the Walmart has a $4 program, as do some other places. Also, the pharmaceutical companies have some things, but those are all, that's another navigation problem. Those are all millions of drugs and millions of programs, and you have to hope that the one thing you need is in the $4 list at the place that you can get to.
So with these places then, Tina, it's not just any generic prescription is $4. It has to be specific kinds of drugs.
I mean, I think they have tried to help, and they have, and people talk about it and are happy with it. But I mean, I think it's general things that most people, most people my age just begin to take blood pressure medication. So I think that's one of the things. But really, the number of drugs out there is mind-boggling.
Well, it is, and they keep coming out with new ones,
Right.
and of course then you get wrapped up in having to take the name brand because they haven't developed the generic version
Right.
yet, and then you've got insurance company staff who are saying, no, we're not going to pay for that. You don't need that. You can do something else. So they're playing doctor.
Yes,
That's another whole
problem
thing.
It is indeed.
That's an issue. Well, the Living Healthy Clinic. Do you happen to have an address or a phone number for them?
I believe I do.
We tried to get them on when they very first opened, and that was probably about 6 or 7 years ago. And of course, they were just getting geared up, and we couldn't pin them down to a date. And since that time, they've been swamped. Of course, as things
they
get,
have been more and more
worse
swamped as people lose jobs.
But I would really like to get them on at some point.
Yes, I'm sure those women are tired at the end of the day.
Yes, yes.
So it's hard. I actually bought them a present. You could think about that.
Okay, but I know they're on Jackson.
No, Doctors, they're on Bowen.
Bowen.
510 Doctors
right,
Court, which is right off Bowen, and it says it's right by the Humane Society. So,
okay.
It's right in there.
510 Bowen Street.
510 Doctors Court, actually, off of
Doctors
Bowen.
Court, okay.
They say they serve mostly adults between 18 and 65. Not too many children. Children, as I said, are served better. Not great, but better. What else do you need to know? They see quite a few people. They have 3.5 full-time employees only. Let's see, they served to date, this year in 2009, they have served 4,500 individuals.
Wow.
That's a lot.
Oh, and I would be interested, if we can ever get them on the show, to find out how that contrasts with when they first opened. I'm sure it's probably tripled.
I think they have that they had 215 new patients last year, and so far this year they're on 300 new patients.
Wow!
So apparently all the other people are people who know it and come back. So
and again, they don't treat anything that's like really serious there. Do they treat chronic type problems
I
there?
think they do help.
Okay.
I think they do help manage chronic.
All right. So can you go there for just a checkup? Or, what kinds of
think
things
that
do they
depends
treat you?
on what you have as coverage.
What if you have no coverage?
Do they need to be? They must have no insurance and be from Winnebago County.
Okay.
Those are the criteria that she gave me.
Okay.
I think that's probably a lot of people.
Well, I guess the best thing to do is if someone has a health care need, they should call and discuss it with them and see if maybe they can get some help.
I think they provide a lot of comfort and advice.
Okay. So
and
that's the Living Healthy Clinic.
They can advise them that way.
Okay. All right. Who's next on our list?
Mary Jo Turner was the nurse from the Winnebago County Health.
Okay.
And county health nurses have always been more of a preventive thing, helping people. It's general things like wearing bike helmets, and but they do help. There's 4 nurses that help the elderly, 4 that help new moms.
Okay.
So I think those are their focuses. With the elderly, one of the big things they do that's a big need, she said, is arranging their medication. Yeah, my own mother, who can do it still, but has like 14 medications in the morning. If she's feeling really crummy, I mean, I know when I'm feeling really crummy, what is this?
Yeah.
And what does it say again? Okay. And it's hard to keep it all in track. So they help manage that, which sounds like a small thing, but is a very, very big thing.
Well,
Reading it's hard, opening it's hard,
yeah.
Seeing do I take this with food and not this one? It's pretty rough. So they do that. I did not know that they provide all childhood vaccines free to anyone.
Okay.
They do mostly serve people on some sort of assistance, but they do provide that because they're preventive. That is their focus.
And that's the Winnebago County Health Department?
Right.
Okay, all right.
And then the last one that was there is Dr. Jim Killinger, who is a retired private dentist, but got involved in the Tri-County Dental Clinic, which I don't know what people know about that, but that is located. It's actually a mailing address Appleton, but it is still in Winnebago County.
Okay.
It's just far from here.
It's probably right on the line.
It is right on the line there, right? And it is seeing as dental care is the biggest gap. That is the biggest gap. They
Really?
will all
Well,
say
I suppose
that.
that's true.
It
Yeah.
is true, and it has been for a while. And as you know, even if you have insurance of your own and a good policy, there's still the dental is like, oh, and dental too, a little, maybe once a year, they can look at your teeth, and two. So they really have not, and it's, and that is rough for kids because once kids get that going, then so Tri-County Dental is actually a miracle of collaboration that happened, and it just must have happened right at the right time. And I don't know exactly when it started. I do have the brochure, but it was something like 5 or 6 years ago in the early 2000s. But it was started by a group of dentists who, of course, saw this need because medical assistance for dentists only pays about 30 cents on the dollar. And most dentists just can't do it. It often makes them look bad, and I always feel bad about that. And they go, well, I volunteer one day a month or one day a year, and I think actually that's very nice, but they shouldn't have to do that.
Right.
I mean, there should be a different arrangement, but that is the problem, the medical assistants. So the couple that do take medical assistants are swamped, and you have to wait a really long time.
Sure.
So Tri-County Dental came, the dentist that first had the idea, one of them donated the land, and then suddenly it was a big, there was coal grants to build it. Marquette School of Dentistry got all involved, and they at the time were just building a whole new dentistry thing, so gave all of the old stuff, and it's not old, but all of the stuff here, and they send students up here who now have to come up here. It is the only dental clinic in Wisconsin, and Jim thought maybe even in the country, run solely by volunteer dentists and hygienists, because Fox Valley Tech also. It's a wonderful, wonderful thing, but still, they will see 7,000 people this year. They see 31 a day.
And I'm sure there's a long list of patients waiting to get in. And if you call, it's probably weeks before.
You can't call. You can't call. You have to just go.
Oh, I see. Okay.
So it's difficult.
Well, I think the underlying message here that we've been hearing, that we can glean from everything that these folks have said and their materials, is that we need healthcare reform in this country, and we need it badly. We need to do something soon.
And they will universally say that.
Yeah, and it looks like we're kind of in that mindset now, and that's something will probably be happening soon.
I hope so.
All right. I want to talk a little bit before we let you go about some of the other things that are coming up.
I thought I turned it off.
I thought you turned it off too.
You saw me do that, right? I did think of it.
Let's just move on and talk about the upcoming programs real quick that you have going on.
Yes, we tried to. These are all on healthcare, and the second one is going to be. It's funny because. Your next taping is with these people. The Lakeland Care District is something being set up in a tri-county arrangement here with Winnebago County, and I think most people don't know what it is, and it's a long-term care public option. Okay. And so we decided to have this next forum, which is on August 24th at Trinity Episcopal, which is Algoma and Division, at 6:30, and that is on long-term care. Okay. And it will also be talking about the aging Disability Resource Center, which we will have here then, which is very important because that will be a one-stop shopping advice place. And I know for people my age who have parents that are now all in different stages of needing something, advice is hard to get, and you will be able to get it there. So that's what it's on. Okay, good. August 24th at the Trinity Episcopal Church, Algoma and Division at 6:30 p.m., long-term care. And if they want more information, they can call you, 235-5918. Right. All right, very good. Tina, thanks for being here. We thank appreciate you so much for having me. It was a wonderful opportunity. And we are going to take a short break, and then we will be chatting with and joined by some folks from ARC. So we'll be right back.
Dear Mom and Dad, Well, I finally have some time off, so I'm writing to tell you that I'm doing well. We have good days and bad days over here. We try to remember the good ones and get through the bad ones. Mostly we have each other, and that's what keeps us going. And Mom, since you asked, if anyone wants to help, just tell them to contact the USO. You can't believe how much they do for us. With love, your son, Michael.
Every year, the U.S. Department of the Treasury receives about 1.4 million reports of problems with paper checks. Checks can be lost, stolen, or delayed. If you still receive Social Security payments by paper check, Treasury wants you to know about a safer, more convenient way to get your money. The Direct Express Prepaid Debit MasterCard. The Direct Express card is new and is available to anyone receiving Social Security benefits, even if you don't have a bank account. Your monthly benefits will be automatically placed onto your card account each month on the day your money is due. While other debit cards cost money, it is possible to use the Direct Express card for free to make purchases, pay bills, and get cash at thousands of locations nationwide. There are no sign-up or monthly account fees. No more waiting for the mail or worrying about lost or stolen checks. Call 1-877-212-9991 or visit www.usdirectexpress.com.
We're in an emergency situation. We don't have extra. We have a little bit of water and a little bit of food. A meeting place, no.
No.
I don't think we have a first aid kit.
We have tuna fish, we have beans, we have canned tomatoes,
True.
you know.
That's true, but that's really not survival food. Tomato paste.
Yeah, well, yeah.
Hi everyone, welcome back to Eye on Oshkosh. We're joined now very happily by Ashley Hesse. He is the Program Director for Peer Power with ARC, and we're going to talk exactly about what Peer Power is, but also Leah Kitz, who's the Executive Director of ARC, and very happy to have you both here tonight. So thanks very much for coming in. The Peer Power, the timing of this is really very good because you just had your kickoff meeting tonight. So let's talk about what Peer Power is, and then we'll get into some of the specifics of it.
All right.
I'm tossing it to you.
That's right. You certainly are. Well, no, Peer Power, it was really a pilot program that began in 2004.
Okay.
Senator Cole helped to shepherd funds from the Department of Education to Wisconsin to try to create a new initiative to assist young adults, students with disabilities, in the public education system, transition into adult life, be it employment, post-secondary education, working, whatever that transition might look like for the individuals. And that was a very successful pilot program. And then a number of years back then, the Wisconsin Council, which formerly known as Wisconsin Council for People with Developmental Disabilities, it's now the Board for People with Developmental Disabilities, picked up this initiative to commit funds to seeing expand in other areas around the state. So it started as a pilot program. We had the opportunity then to apply for a grant to expand it to our area, and we're fortunate enough to receive that grant and bring it to the local school district in this area.
We were only one of 4 in the entire state.
Wow.
So yeah, one of 4 recipients. So it's pretty wonderful.
How much was the grant for?
Oh, not a whole lot.
But enough to help
get
you get it going.
Yeah, and it's a multiple-year project.
Okay.
Yes.
All right, good. Well, let's talk about some of the specifics. You kind of touched on this, but who can participate in Peer Power?
Peer Power is really specifically geared for students in high school, students with disabilities in high school. So depending on what time they get into that, it could be 14, 15 years through the age of 21 years, 11 months. It'd be like once you hit 22, you tend to no longer receive the special ed services. So that is the target group, that transition age. It's a pretty broad range, but that is the target group for the project.
And some kind of developmental challenge? Or
Any
not
kind of disability.
Okay.
For this grant.
All right. Okay. All right. Okay. And I realize you just had the kickoff meeting tonight, but what took place at the kickoff meeting? I mean, were there people there who are going to be participating in this? And if so, how many?
Yeah. Well, we had about 6 that were interested, and only
Okay.
like 3 were able to make it.
Okay.
So, very small. You know, we just had the opportunity to kind of catch up with the summer school and try to do some recruiting in there. So it's really very small start. That's how it works. You know, it's a brand new club, if you will, for the
Sure.
students. So some of the things that went on, really, they're all get to know you sessions. We've not met each other.
Yeah.
Some of them never been to the ARC where we met. You know, so there's a whole get to know you, tour the place, and that. So you know, just a general round table, some
Sure,
icebreakers,
sure.
but then brainstorming, because really peer power, it's unlike a lot of other programs, if you will, that get funded to support students or individuals with disabilities. They tend to be driven by the agency or an organization or you know, whoever is receiving the funding. With peer power, its intent is to really allow students to self-realize their own potential and their own inner strengths, and allow them to steer this and develop this program and make it really, I look at it more as a club, you know, make it their own. So it's just explaining that process and my role in it, and you know, the ultimate outcome of it's total peer driven, and I'm just there to help get the supplies and the supports and the assistance they need to make it happen.
Kind of the organizer.
The organizer,
The facilitator, if you
There,
will.
Yes, absolutely.
So how does it work? I mean, talk to us about how someone can get involved in this, and then what they're going to experience as they become more involved.
Okay. Well, I guess really if someone has an interest, or an individual student or a family member, to just contact the ARC at our number, which is 236-9230. And that's just the preliminary start to get us, you know, let us know who you are, what your interest is, and there's an application, you know, for students to just apply for that. It's all good, those just good experiences, you know. And then that's it. Our next meeting, we're going to meet again next week on Thursday from 3 to 5 at the ARC office, which is on 115 Washington Avenue here in Oshkosh. And again, you know, just pick up from where we left off, you know, a little more orientation. But each time we meet, at least until the group is steering its own course, I tend to try to introduce an idea or a concept. So one of the things we talked about today as just a grounding principle of the whole group is the idea of self-determination.
Okay.
And really, what does that mean? And break it down, you know. So we'll start with an educational component at each session, some type of learning, and then opportunities to, you know, express their understanding and maybe put it into practice, and then really build it around, ideally, a fun activity.
Sure.
You know, some type of an event. So today we started with self-determination, then brainstorm for a good period of time, amongst other things. What are their interests? What would they like to do? What haven't they tried that they might like to try? You know, what can we do as a group to try to organize and work together to make those you know, interests a reality for the students?
So it's structured, and yet they can really kind of make this whatever they want within reason.
It is, but there are 3 primary purposes of peer power.
Okay.
And those are building skills,
Okay.
support, and knowledge.
Okay.
And so within that idea and having fun, we are working with the students to pull together what is it that they want out of their life, and while they're in school, what can they do to make that happen. So getting the most use out of being in school now, because this is probably the most support they'll have in their life.
Oh, yeah.
And so so what we're going to be doing is doing some teaching things, so there's some specific things for them to learn, helping them build some support networks, kind of also looking at what their goals in life could be or are, and that's part of what Ashley's talking about with the self-determination, that many people with disabilities have a lot of people telling them what to do, and more or less to some extent depending on the person, but really what is it that you like to do, and what is your interest, and here are some jobs that maybe could work for you or whatever. So it'll be exploring some of that, and also skills, knowledge, and support.
And support.
All that. And the skills part is the assertiveness. asking for what you want now while you're in school so that you are able to build toward what you want later. Because we find a number of people over the past several years, and actually longer than that, who, while they're in school, as I said, that they get a rich environment of support and knowledge and peer interaction and that kind of thing. And many of these students leave school, and there they are. You know, we have parents call and say, well, now that they're done with school, they're just sitting at home and watching TV and possibly gaining weight, or, you know, they don't have any friends, they're not doing anything, and they're really concerned about them. So what we want is for them to look past that and start working toward past school.
So this is kind of a mentor type program, if you will.
That is a component, and what you touched on earlier, there is some structure there, but yet it's still open, and that's a challenging approach to starting a new program or project or club or however you want to frame that. But it's also, to me, one of the most exciting parts. As I can't wait to see and work with these students to really develop that team building, that leadership, and just to help provide that opportunity for kids to get together and really realize they have a voice. Sure. Just because you're a young student, with a disability, you have a voice, and sometimes it just takes a friend or a few friends to kind of help shepherd each other along and to make that voice a stronger one. So that's really exciting to me. It's a challenge to sit here and kind of let it just happen and not step in as an adult and kind of gear it towards what I think is important. But yeah, it's exciting. But that mentoring piece, and I'm glad you brought that up, that is a really strong component of it, because I think anyone who may have had the opportunity to have a mentor in their life, whether it was some sort of a formal or informal process, there's such growth and learning that can come out of that, and so many opportunities. As we all know, those social networks, that's where the real action's at. That's what makes life go around, and who you know and your relationship to them. So that mentoring piece is something that we're working towards all along the way of establishing a pool of interested people. We have the application process and all of that, but of mentors, of similar age peers, maybe some young adults who may have just graduated a year or so with disabilities, from high school, and maybe they're in the workforce. Maybe they're pursuing some post-secondary education. Those are some pretty valuable mentors, and we have a few lined up, but it's a constant outreach effort. And then just really other working professionals, because what I've learned, I've been working for the ARC for just under 5 years now, and in that capacity, when you get to talk to these kids and you talk to the students in the schools, it doesn't really matter who they are. They're just amazing, and it's always so exciting. Then the more you learn about them, the more I'm consistently shown that, geez, I kind of had some sort of preconceived notions as to who you were, and they're always showing you another face of youth and who they are.
Yep. It's a real depth of understanding of things that most people don't see.
And isn't that the way it is in all walks of life, though? I mean, no matter what the situation is, we all have preconceived thoughts about someone, and boy, most of the time we're wrong.
Yes, you try not to, and you know it, but still you can.
Yes,
but
I find myself wrong numerous times in one day.
And you learn to be okay with it. And that's one of those wonderful things that can be taught and shown about, especially with mentoring and one-on-one. It's like, okay, if you have a professional and you have a young person with disabilities interested in, say, I don't know, aviation or whatever, well, sure, there's so much opportunity there that unless you're in the field, you kind of, as an outsider, we have a limited perspective. Okay, boy, you have people that fly the planes, people that serve food, people that help navigate. I mean, there's only a limited number of amount of understanding that can come in there. But building those connections, I think, as with the mentors based on interest or that the student might have, is one of those things that, I just think it's going to open doors of opportunity. And then, like you just touched on, making mistakes. Well, yeah, sometimes nobody likes to make mistakes or look the fool, but if you have someone you can connect with, it just helps ease that along and remind you are a person, and just help guide things through. Because really, a lot of times students with disabilities, just because they're in school doesn't necessarily mean they're an active or included participant. I mean, there's only so much that structures and bureaucracies can do to make that happen.
Right.
But then it's really that one-on-one relationship. And you know, a lot of kids have great social networks, but then there's a lot that really kind of are left on their own and kind of marginalized for whatever purpose and whatever reason. But,
And that gets amplified after they're in school.
Sure.
And what they're looking for, the students with disabilities, is just, they don't want to just be busy when they're done with school. You know, they want something meaningful. That, you know, the adults that we know that really struggle are just like either just busy with stuff or most of the time not at all.
Yeah.
And just trying to keep themselves busy.
Sure.
And so, you know, that's what we're after, is what is it, what's meaningful to you, and how do you want to go about getting that?
yeah, and what you can do then as a self-determined individual to bring your goals and aspirations and dreams to reality, because it takes a lot of work, you know, but you need those skills and that experience to get there.
You know, I realize that this was just your first meeting, and there were only 3 people there as opposed to 6 who expressed interest. But what kinds of things did they share with you folks about, you know, where they'd like to see this go and what they'd like to see happening? What were their thoughts and comments?
Well, some of it happened to be obviously around the social element and the fun activities, you know, and that was, I would say, that's the primary focus.
Yeah.
Just getting out and participating in community life, whether it's going to a favorite restaurant. Well, I would like to do that, but I'd also like to have a friend and some people to come with me.
And how do I get there?
You know, you know, right. So, you know, just to make that simple experience occur, there tends to be a lot of other barriers that exist, and so they talked about some of those barriers. Transportation being a primary one, and then the cost. You know, not only for the transportation but for the food. You know, just things that's depending on where you are in life.
Things that most of us take for granted.
To some extent, yes. So we talked a lot about the social kind of things, what they like to do, you know, different sporting events. And I was encouraging them to dream a little bigger, you know, just really, you know, bigger and, you know, broader ideas. But
what would you like to do that you can't do now?
Okay.
Yeah,
You know,
those
not
kinds
just
of
what do you
things.
like to do that you do,
Yeah.
but, you know,
If you could do anything in the world, what would it be? That kind of thing.
Yeah, and there was honestly, I think, not a lot of struggle in expressing that. But if you don't know what you don't know, you can't really talk about it.
Yeah.
So that, to me, again, is part of this experience, is opening ideas and doors and opportunities for these young students who may not have had a lot of opportunity to experience you know, the things. Well, so just go back to aviation, because we got done with the EAA and I love planes. But they had, you know, the conversation about flights. You know, one kid had an opportunity already to fly in a small plane and participate in, I believe, their the Young Eagles thing. You know, great. You know, but the other student didn't. You know, and only flew on a big plane once in their life. You know, I think the other kid had never flown at all. So I thought, well, okay, there's a broad range of experiences. So now, what can we do as a group to maybe help share that kind of an experience with each other and make it happen? So, yeah.
This was actually
Simple.
our first meeting, but we had a meeting previous with parents and students to kind of explain. That was a bigger group, but it was more us explaining what it is. It wasn't so much kicking it off, but it was just a way to get started. So we expect that when the semester starts, that we'll have more people interested and students talking to students. It's a little difficult in the summer for them to communicate with each other and that kind of thing too.
Yeah, and to make connection to students because they're in summer break, unless they happen to be in summer school, perhaps. So.
Yeah. Now, if somebody wanted to get involved with this on a volunteer basis, are those kinds of opportunities available or no?
They are, and again, there's always the application and the process to volunteer. And again, it's just contacting the ARC. Those volunteer opportunities at this point, I honestly wouldn't be able to say it's going to be, you know, you're expected to be here at, you know, whatever place and time, because the students are going to be generating those opportunities, and then I make it happen. So yeah, again, just like the pool of mentors to help support one-on-one mentoring if a student is interested in a mentor, and then the training that goes with that, there's also that volunteer opportunity. And, you know, so it could work with Peer Power, but then just if they have an interest in just supporting and helping out, you know, individuals with disabilities in general, we have a lot of other opportunities, you know, through the ARC.
In addition to that, if anyone would have an idea of a cool activity that the students might, for example, the flight thing, but somebody may have access to something very cool that would be a unique experience that the students would enjoy, that would be very cool.
Absolutely, and we've come up with different ideas about the whole self-determination piece and advocacy, self-advocacy training, and like, what does that mean? Well, okay, some of that touches on understanding the laws. I mean, special education, you know, giving the students that knowledge of what rules schools are already following and what rules teachers have to follow, and just the process. So that knowledge of how the process works allows them then to participate and be an active participant in it. So, well, geez, then do we go visit, do we set up something with an attorney? If you have an interest in law, we're talking about law and it happens to be the content of the educational piece for this meeting, well, can we go to, you know, visit, you know, just go tour places, you know, job experiences, but I guess that's not quite what it would be, but, you know, just to connect with who's doing that similar work in the community already and introducing to places, you know. Getting in a taxi cab or learning to ride the bus, you know, building that ability to be independent. Just because you want to get out there, a lot of times that's a huge barrier to just riding the bus, figuring it out, not being afraid, you know, dealing with other people if they start to, you know, there's harassment issues, there's things that come up, you know, and a lot of times individuals with disabilities, depending on the type of a disability, really, that's a challenge and it's intimidating, and I can't tell you really how many people we know, adults with maybe an intellectual disability, that, you know, they've had enough experiences to where they're afraid to get out and about on their own. So, but
you mentioned before about things that we take it for granted, getting around and things, but students with disabilities, for us to plan, for example, we want to do maybe an after-school event, possibly at the school. Well, they can't come because they have a special bus that they take, and that's right after school, and they're not able to maybe take the regular bus home later. And so transportation creates, you know, somebody may have mobility challenges, but they just may have challenges just getting around, period, because they have a disability, or that they need to be accompanied or something like that. And so we, looking ahead at that, we got a small grant also from the Community Foundation to help with some transportation issues this year to kind of get this launched so students can get to places and learn the system and stuff. So that's another element of it this year.
Well, that's great. You know, in our remaining minutes, maybe we could, was there anything else about Peer Power that either of you wanted to share?
Well, really that it's, again, it's peer-driven, and that's what's pretty unique about it. Those students with disabilities having an opportunity to create their own, you know, social network, their own club, their own, and then just have somebody from the outside support it as much as possible. That is, go ahead, pretty unique. You had something to say?
I do. I just want to quick say that what's really exciting about Peer Power is the focus on the schools and the new laws and things, because when the ARC started in 1952, it started because parents had kept their kids home rather than sending them to institutions, and then when they had them at home, there was nothing in the schools for them. There's no such thing as special ed at that time. So they formed the ARC because of that, to work with the schools and try to push for some kind of education for their kids. And so this is sort of a natural, you know, many years later, over 50 years later.
It's come full circle, and students are now being self-advocates.
Well, I'm excited for this program, for you all, and for the participants, and you know, please keep us posted on what's going on with it, and as it unwinds, we'd like to, you know, do something again in the future. But in our remaining minutes, and I think we're down to probably about 3.5, 4 minutes, you know, maybe we could talk a little bit about, you know, some of the other programs that you offer. Real quickly at the ARC, and you know, how people can get involved with that. I know we've given the phone number, but we can give that again too. But what are some other things that you guys offer to folks?
Well, we actually have things. Remember, I said that sometimes people are just sitting at home, have nothing to do, but there's also plenty of people in the community who don't realize that we have a number of programs that just are educational in nature, or we go visit some of the treasures in the community, some of the museums and things like that, and it's open to anybody. They can just come and be part of it. We have that, we have some social programs, and we also have advocacy. We have plenty of parents and individuals who come in and say, I'm having trouble dealing with this, or I don't know what resource to go to, or whatever, and we try to help them work through any variety of, you can imagine,
I'm sure that
situations.
there's a ton of things that
And one thing I
sometimes have to be
would
worked
like
through.
to mention is that one of the groups that we do host, well, we have a Down syndrome parent support group, but I also host a traumatic brain injury support group, which is, again, one of these areas that is just really under-recognized and service system that's underfunded, and there's so much awareness and things that need to take place. But that's something that we've been doing for a number of years, and it ebbs and it flows, but that takes place every other month. The next one's coming up August.
Next week.
Next week, August, next 13th, I think it is, on
Yes.
Thursday from 10:30 to noon.
Okay.
And again, that one I think is really unique and very cool. But yeah, educational programming, weekly, monthly social activities. A People First group we're a host to, which is a statewide network of self-advocates, adults generally.
Okay.
So just to find out more information about us, there's plenty more we could say.
Sure. Oh, yeah,
If
absolutely.
people just call and ask us to add them to our mailing list, they'll get a monthly listing of events and activities that are happening by the ARC. And also, we like to inform people about things that are happening with public policy that may affect them.
Right.
And we try to, as much as we can, influence that to the benefit of people with disabilities and their family members. So if people call 236-9230 and ask to get on the mailing list or ask whatever questions they have, we'll be glad to answer.
Okay. And you folks have a website as well, and that is arcwinnebago.com.
Yes.
Correct.
Correct. And do you have some of the advocacy issues on there, updates and that kind of thing?
Well, we should.
Okay.
It's
Maybe
a
by the
work
time
in-
it's theirs, it's a work in
It's a work
progress.
in progress.
Websites are always a work
We're
in
just
progress.
we're just getting
Yes.
it up this year, and yes,
It
it's
is
been
a work in progress. And seeing we have such a huge staff,
Yeah.
amongst other things.
How large of a staff do you have?
Well,
2.5 FTE.
Okay.
Yeah.
Yeah.
All right. And I'm lucky enough to have two
The
of you
two-
right here.
Yes, yes.
Doesn't our city councilman, Bob Peschel, works for you all too, right?
Yes.
Yep, yep.
Is he the half or?
Well, he doesn't like to be called that.
Yes, Bob
he's a-
does, and he brings a lot of great experience around, community organizing and his background in life. It's really been a benefit.
Excellent.
Yes.
Well, very good. Well, thanks to both of you for being here. We appreciate you giving up part of a summer night here as summer starts winding down a little bit. Again, you can reach folks at the ARC at 236-9230 or on the web at arcwinnebago.com. So find out about Pure Power and all the other programs that they have to offer. Thanks again to both of you. We
Thank
appreciate
you.
it.
Thank you very much.
And as always, thanks to you. We'll see you next time. Until then, take good care. Keep your eye on us. We've got our eye on Oshkosh.